Hi everyone, this is Dr. Faye Felicilda Reynaldo. I am very grateful to present the closing remarks for the second National Nursing Research webinar. I have enjoyed viewing and reading everyone's presentations during this webinar conference. I have learned a lot regarding ongoing research studies of our nurse researcher colleagues. I laud our colleagues on their continued curiosity, inquisitiveness, and creativity in researching and developing knowledge, even amid uncertainty brought about by the pandemic. The research our colleagues have presented shows that we are persistent and persevering in pursuing answers regarding our thirst for knowledge despite hard times. We are genuine innovators. I noticed that the majority of the questions we like to answer for our research focus on the who, what, when, where, and why questions. We like to explore, describe, explain, etc. We are less involved in interventional studies that delve into the how of things, and those studies that look into improving processes for our population's health. When I say we, yes, that also includes me. Our choice in research focus is quite understandable. After all, interventional studies such as randomized controlled trials or quasi-experimental studies are more expensive to conduct. They require the development of stricter protocols. They use more personnel and they take up more time. Furthermore, funding is hard to come by these days when we are competing with big names in the research industry. May I ask you, though, that you consider conducting pragmatic trials or quality improvement projects in your facilities? According to Merriam-Webster Dictionary, pragmatic means dealing with things sensibly and realistically in a way that is based on practical rather than theoretical considerations. Many nursing scholars worldwide these days are conducting replication studies of evidence-based interventions in their facilities on a smaller scale to see whether applying these interventions are feasible. They conduct these small-scale projects to see whether interventions can be incorporated in their current care protocols and will improve the care of their patients, improve patient outcomes, or their processes in the healthcare system. Because they conduct these evidence-based projects in a practical manner, sometimes real life gets in the way. Staff who are often used to their care processes may not always follow the study's intervention protocol. Nevertheless, with continued encouragement and supervision from the researchers, protocol adherence can be as high as 70%. I work with several DNP students in their quality improvement projects or pragmatic intervention studies to improve patient care processes within their facilities. I present to you two project outcomes. One student provided an educational intervention to nurse practitioners and staff nurses at retail clinics about the evidence of the need for antibiotic stewardship when caring for patients with upper respiratory infections. In this project, the student provided the NPs and staff nurses with tools to encourage patient education on antibiotic stewardship. However, the student did not dictate how the NPs or staff nurses will educate their patients. When comparing the previous year and current year rates of antibiotic prescribing, the student found a 52% decrease in the antibiotic prescribing rate for upper respiratory infection diagnoses. In another project, my student conducted an educational intervention among 40 cancer patients about the evidence on how to counteract fatigue by doing exercise. In her presentation, she shared about the different exercises that could be done by cancer patients to assist with reducing fatigue levels. She provided the tools, such as pedometers, to keep track of their activity level. She encouraged them to increase their activity level in the next 8 weeks and to record their daily steps. Then they were to report their weekly fatigue levels and quality of life. After 8 weeks, she was only able to follow up with 5 patients. But these 5 patients showed an increase in their daily steps and reported reduced fatigue levels and increased quality of life. In this pragmatic trial, the attrition rate was a problem, but her pragmatic intervention helped 5 students improve their health outcomes. Pragmatic intervention studies or quality improvement projects for evidence-based practice are not perfect. There are multiple barriers that scholars and researchers will encounter. Attrition rates are sometimes high. Also, I know my students are having difficulty disseminating their results through publication. Conferences, however, are more welcoming regarding the dissemination of results of evidence-based practice projects. While I supervise these students with these types of projects, I find them very anxious. I always tell them that the type of intervention they are introducing in their facilities are ones that have already been supported as effective by multiple randomized control trials, systematic reviews, and or meta-analysis. We are now testing whether the intervention implemented within the facility is sustainable in a real-world setting. So if we can help even one person using EBP, then we have done a lot. I urge Filipino nurse researchers to implement pragmatic intervention studies backed by evidence in their facilities to better the Filipino people's health. Thanks so much for the opportunity to present during the webinar conference. If you have any questions, do not hesitate to contact me. I am happy to hear from you.